Tonight, we celebrate the leadership and legacy of Brent McGinty, the CEO and president of the Missouri Behavioral Health Council. While he's been involved in the private sector of mental health for more than 13 years, his roots come from state government.
Met Brent first when he was working for the Missouri Senate, and he was a staffer who worked on Appropriations Committee. And so I met him because we appeared before the committee a lot and got to know Brent at that point in time and actually got to work with him. My staff particularly got to work with him at that period of time. And then later, my executive team decided that they wanted to steal him, which they did their best to do, and they were successful. And so he came to work for the Department of Mental Health.
Just so everybody knows, I'm not a clinician. I'm kind of a budget nerd. I like to get in there and find the money and negotiate and develop those relationships and tell that story, and then just watch what my providers do with it. It's so rewarding to see what they can do there locally and hear the stories. It's inspiring.
We asked for funding for mental health liaisons around the state, across the state, who would spend all of their time working with police officers to help them when they confronted a person and they wanted to get them in treatment instead of putting them in jail, which was terribly important. And we were successful in getting that program. Brent took leadership role. He was working in our appropriations process at that time. He took a leadership role to make that happen. So the liaison program was really, really important. And in relation to that, we had a program called CIT, which is Crisis Intervention Teams, who were law enforcement officers. And they needed training in terms of, so how do you address a person who is in crisis?
I tell you, I have a special place in my heart for our work with law enforcement and understanding there'll always be a response resource for our communities. They always will be, but how do we work with them better to train them on how to respond, number one, but then how are we taking care of them as people as well, because they have a lot of trauma that they deal with.
Law enforcement is normally very hesitant whenever we talk to mental health providers or clinicians. There's always a gap between the information sharing, both with the legal ramifications and the fact that it's an uncomfortable subject to talk about mental health. One thing that I can say is that Brent specifically works towards bridging those gaps. And in that, we see that the mental health field and law enforcement share the same communities, share the same utilizers of services, and really how can we better navigate those systems.
Brent has been and continues to champion many early intervention initiatives, from community behavioral health liaisons to CIT to health homes and treating the whole person. In 2022, he also made it possible for behavioral health providers around the state to make some infrastructure improvements with available state funding.
We had the opportunity to submit project ideas for capital improvements. That project year was incredibly important to the providers. At Ozark Center, that meant Turnaround Ranch was transformed. And we were able to do things at 50% of the cost of what we normally would have had to do. It is very rare in this world to be able to do capital projects like that through a state-funded mechanism, but Brent made it happen, and lots of really great opportunities popped up all over Missouri because of that.
But perhaps the capstone at this point in his career is his work on the Certified Community Behavioral Health Centers, or CCBHCs.
Yeah, I'm proud of two efforts. You know, the CCBHC movement nationally, Missouri was one of the first 8 states selected, and we had the most agencies volunteer to do it because it was volunteer. You didn't have to do it. But we had 15 step up, which is very impressive. And the most number of clinics and the most numbers of individuals served. So very proud of our system and its providers for stepping up. And Senator Blunt told me when we did that, Brent, you're going to have to give me the data. We got to show that we're improving access. We got to show that. And so that was the big challenge for our system is, okay, we're going to do this new thing with a new way of paying for services. But if we're going to do it, let's really figure out where are the gaps and why aren't we serving the people that need it? And let's start doing that. So open access and different hours, different ways of meeting people where they are when they need care. And then on the SUD side of things, I had a lot of providers, and God love them for their patience, that were like, hey, we're not a CCBHC, but what about us? And so really appreciate the partnership with the state and the provider system to work together to say we need to modernize our SUD system and figure out a different way of compensation, a different way of kind of organizing ourselves and figuring out ways to improve care. And so I'm really proud of that SUD transformation initiative, and being able to support that has really helped.
I think one of his biggest accomplishments is just the fact that he's helped build and orchestrate a system in the state of Missouri that not only works, but is widely recognized as one of the most incredible and a leader nationally. And I think that's just massively impressive.
He actually furthered a legacy for community behavioral health that makes it some of the best in the nation.
Brent's energy is contagious, and he possesses a gift for being able to figure out the difficult issues. And while he's been a part of a lot of positive changes in the mental health system, he will be the first to tell you there is much more to be done.
Here today, literally watching some cool policy happen where it's changing the field a little bit in Missouri. So, really cool, right? But then I know there's stuff down the road. I know we need to continue to do better. I know we need to find dedicated funding. I know we've still got new things to learn and new ways of doing things, and how we learn from each other can get better.
Bottom line is, Brent, the work that you've done, not both in the Missouri legislature and then in the Department of Mental Health, and now with the Community Behavioral Health Coalition around the state, has improved the lives of thousands of Missourians over the years. And for that reason, you should also be proud of yourself.
I think one of the things that I would like to leave behind in Missouri is a dedicated stream of revenue for mental health. Our system for decades has been kind of like other parts of the budget. It's up or down depending on the economy. Well, access to care doesn't care about the state budget if it's up or down. People need care when they need care. My big challenge and what I'm going to push for the next several years is how do we as a state address that with some sort of more stable ability to serve those in need when they need the care.
What really is impressive about Brent is he comes up with ideas that will last forever. His impact on Missouri and Missourians going forward will last a very long time.
I mean, when you think about the words lasting legacy, it's fits Brent to a T. Because the changes to the systems and the implementation of the programs that he has isn't something that was done to achieve a goal. It was done to build a community and to build a state structure that's going to last well beyond him or any of us.
And that is why Brent McGinty is a lasting legacy.